So what can be done to end India's high levels of air pollution, especially in North India, once and for all? This is Earth Chakra, where I try to simplify the science and the solutions about air pollution and climate change. And my guest today is Dr. Soumya Swaminathan. She's a stalwart in global health. And the context of why we're speaking to her today is that she's the first chief scientist of the World Health Organization. Dr. Swaminathan was Secretary to the Government of India for Health Research and Director General of the Indian Council of Medical Research, ICMR, and she is the chair of the M.S. Swaminathan Research Foundation, founded by her father, the legendary M.S. Swaminathan, perhaps best known for helping to fix India's food security crisis. But Dr. Swaminathan is also spending a lot of time these days on how to fix the problem of air pollution. She's the co-chair of an international group called Our Common Air. Ma'am, thank you so much for making time for this podcast. If we may begin by speaking about this whole issue of extreme pollution making headlines once again. But it is not just a question of Diwali, it's not just Delhi. And one of the things that gets overlooked in a lot of the headlines is the danger that we face from short-term exposure. Could you talk to us about this? What is short-term exposure? What does it mean? And how dangerous is it?
Yes, thank you very much, Chetan, for highlighting air pollution as a critical health issue. To me, it is first and foremost a health issue, and a lot of work that's been done over the last few years shows that air pollution is one of the biggest risk factors to health today globally, but also in India, because India, we know, features amongst the most polluted countries and is always on, many cities are amongst the list of most polluted cities in the world. So we're talking about a situation where we have an underlying high rate of air pollution. So, as you know, the national air quality standards is set at 40 micrograms per cubic meter for something called PM 2.5, which are the smallest tiny particles, which actually are very dangerous for human health because they're so small that they go into the lungs and then they get absorbed into the bloodstream. They're able to cross the barrier in the lung and get into the bloodstream, and then they are carried, these tiny particles, all over the body, and they set up inflammation. And so what that does really is to create a situation where the organs of our body are under stress, whether it is the heart and the vasculature, whether it is the brain, whether it is the kidney or the pancreas. Chronic inflammation actually drives a lot of diseases which result in what we call as non-communicable diseases, like diabetes, like neurodegenerative diseases like Parkinson's disease or even dementia. In addition to, of course, the impact directly on the lungs and the airways. Now, when the body is exposed to this, it has long-term changes that keep happening, internally, which we are not able to see with the eye. And then you're suddenly exposed to a spike. So when you're exposed, what we call short-term exposure, where there is an increase in the pollutants on a particular day, it could be because of, some burning that is happening, or it could be because of firecrackers, or it could be because of a dust, or, whatever it is. When the pollutants spike, then what happens is that there are acute effects. So you'll find that there are more hospital admissions on the days immediately following that spike because it sets off an acute inflammatory response. People with asthma get more sick. People who have underlying lung disease get sick. And even the number of heart attacks goes up. There is data from many countries now showing that heart attacks and admission for cardiac-related problems is linked with the ambient air pollution levels. So a short-term exposure usually happens on top of a chronic, ongoing exposure to higher levels of pollutants. And all this really adds up to poor health outcomes. And health, as we know, is very closely linked to the economy. So if you have people who are unhealthy and requiring a lot of medical attention, it's not only a drain on resources, the health system, but it also means less productive days being spent. And therefore, ultimately, all of this does add up to an impact on our economy and, percentage of the GDP that we are losing thanks to poor air quality.
So I just wanted to pick on a couple of things you had mentioned. Heart, it affects the heart and it affects asthmatics. So, one, what do you define as short term? Would it be 1 day, 2, 3 days, or some period longer than that? And does this kind of short term exposure to PM 2.5, high levels of PM 2.5, actually result in fatalities, premature deaths?
Yes. So short-term exposure is really over a few days to a few weeks. And it does lead to both increased mortality and morbidity. Furthermore, we have seen that, in places like India and other tropical countries, that heat and air pollution also have a synergistic effect. So if you have, during the summer months, the very hot days combined with air pollution, then it's been shown in studies that your risk of death actually goes up even further, gets multiplied by 2 or 3 times. So we also have to keep in mind that many parts of our country are also now getting exposed to higher and higher levels of higher temperatures over prolonged periods. So there's also now data that it's not just the PM 2.5 and the CO2 that we need to worry about. We need to worry about other gases like the nitrous oxide, sulfur dioxide, and ozone in particular. And this is tropospheric ozone, which is different from the ozone which is high up in the atmosphere. This ozone gets produced, from waste and decomposition and so on.
So tropospheric, sorry to interrupt. Tropospheric means along the surface of the Earth.
Surface of the Earth, as opposed to the atmospheric ozone. We all know about the hole in the ozone layer and how the Montreal Protocol has helped to fix it, because we reduced the emission of CFCs in refrigerant gases and so on. So that's been a very successful example of a global commitment that's actually worked. We did fix the ozone hole. However, the ozone at the ground level has been increasing. Similarly, methane. These are not things that we talk about a lot, but actually they cause a lot of human health impacts. And at the same time, they're also contributing to global warming.
So that's the risk of death from short-term exposure. What we've seen in the headlines in recent days, and this is October, is pollution levels, PM 2.5 levels, at really fine pollutant which defeats our body's defense mechanisms, settles deep into our bodies, that touching levels of 150, 200, 300 on on Diwali night. It went up to really high numbers, 5, 6, 700. But I came across a really startling fact the other day, a study which showed that rural women who are using solid fuel, biomass fuel, they are they are exposed to a PM 2.5 level of something like 600. That's what the study found on a daily basis. So the contrast is really stark. On one hand, you have Delhi, places like Delhi, which make headlines for a few days of extreme pollution. But here are women who are exposed to 600 micrograms of PM 2.5 on a daily basis. There is some kind of an inequity. There is some kind of lack of awareness of the kind of problems that they face. This is an area of focus for you also. What are your suggestions? How should this be tackled?
No, you're absolutely right. I think quite often our attention is focused on the Delhi and the Delhi NCR region, usually at the time of the year where many things are coinciding, the change in the weather patterns, so that there's no wind, pollutants are settling down, there's stubble burning happening in the fields around Delhi, there's also Diwali, which comes around the same time, and all of this adds up to a spike, and then this continues for several months. We forget about the fact that a large part of the country is exposed to high levels of air pollutants, including this PM 2.5, the small particles, and that women are disproportionately impacted exactly because of the reason you mentioned, that we still have a significant number of households in India that are using biomass for cooking and heating, despite the success of the Ujjwala scheme, which is a very ambitious and a very, I should say, pro-woman and pro-equity scheme, which actually provided an LPG connection and subsidized gas cylinders to today, I think 99.7 or 8% of Indian households actually own a gas connection. So it was amazing that that was achieved. However, there are still economic considerations, and in some cases, delivery because of distance or remoteness, which means that many households are not using LPG as their sole fuel. They are using still biomass, and whenever they can afford it, they replace the cylinder. So this is a question of access to clean energy, in addition to the biomass actually contributing to outdoor air pollution. So a study that was done by CEEW a couple of years ago showed that across India, indoor generation of air pollution contributes about 20% to outdoor air pollution. This is less in South India compared to North India. So when you get into the poorer states and the rural areas, you'll find that North and Central India, in many states, contributing 30, 40% of outdoor air pollution is coming from this indoor. So I think addressing this would not only help the cause of women, as you said, who are often exposed to very high levels of particulate matter coming from the burning of biomass, and not only women, but the small children who are often with the women while they are cooking are exposed to this, causes a lot of health issues. Plus, it would impact the outdoor air quality as soon as you address this issue. And of course, it's a very pro-poor and a pro-gender initiative as well. And therefore, we need to find a way of actually expanding or universalizing the use of LPG amongst the population. There are various ways to do this. You could have targeted subsidies where those who are able to afford are actually paying a little bit more. In fact, that's how the Prime Minister actually launched the PM Ujjwala scheme, by asking people to give up their subsidies. I think that was a great move, and we could continue that so that there could be a targeted subsidy provided to the poorest households so that they could use LPG almost universally. But we could also use climate adaptation funds and the funds that are allocated to dealing with air pollution through the National Clean Air Program to address this issue of indoor air pollution. Because I think whatever we're doing in the other sectors, unless we also address this, we are probably not going to solve the problem of outdoor air pollution.
The Ujjwala scheme has, of course, helped a lot of families, something like 100 million households. And according to one study, it saves something like 150,000 lives annually. Has the scheme run out of steam? Is funding a problem?
See, as I mentioned, I think, we've got to always review schemes and see what the opportunities and challenges are. So when this was done, a study has been done by CEEW, which showed that while the scheme has had amazing impact in terms of reaching households at scale and also saving lives, today the challenges are that significant proportion of households are still not using LPG as their sole clean energy cooking fuel. So they're mixing up with a lot of biomass in between. So that's actually diluting the potential impact of this program. So I believe that based on these findings, we need to see where we can strengthen it. One is expanding the number of dealers, or ensuring that dealers actually deliver cylinders to remote areas, because that has come up as a one of the issues and challenges. But the other is obviously making it more affordable. And a randomized trial that was done by Dr. Kalpana Balakrishnan and her colleagues from the Sri Ramchandra Medical College and Research Institute in Chennai showed that there was a linear relationship between the price, inverse relationship, you could say, between the price of the cylinder and its use. So the lower the price of the cylinder, the higher what was its use, because which woman would not prefer to cook with LPG compared to going out and collecting wood. Firstly, all that drudgery of going and collecting the fuel, whether it is wood or dung, and then sitting in this environment where the smoke basically is blinding her and creating a lot of respiratory issues, eye issues, and also impacting her children. So there is no doubt at all that the acceptability of LPG is very high. There are these financial barriers which need to be removed. And I'm sure that if we put our minds to it, we can find a way to solve that for the next few years, because as incomes in India go up, the affordability of these things will go up. We also need to create, I think, awareness. And this is where our community health workers, our ASHAs and ANMs and Anganwadi workers could also build awareness amongst rural women that exposure to smoke while cooking is very bad for health. People don't really talk about air pollution and its impacts. So maybe putting that in as part of our preventive health programs could also increase the uptake and usage of LPG.
Very briefly, you had mentioned on how tackling household air pollution can actually bring down the level of India's or the level of overall air pollution of various regions. And I think it's something to the tune of bringing it within the ambit of the national standards.
That's
if
right.
I'm not mistaken. Yeah.
So I think there has been that modeling done to show that if LPG use is universalized, that we can more or less bring down so it's got that kind of high impact. We can come within the range of the national air quality standards.
Right. The other thing is, we've been speaking about air pollution, but I briefly wanted to touch about the other kind of pollution which has a big bearing on air pollution, and that's solid waste management. And you had recently presented a deck which showed that there was something like 3,000 legacy dump sites in India. What is to be done with this? We hear about a lot of people talking about it, both in government and outside government, but these dump sites and the problem of waste doesn't seem to ever get resolved, apart from a few examples.
So here again, I think we need to use data, technology, and science together, and empower the municipal corporations and other local bodies which are in charge of solid waste management. It has to start, of course, with segregation. The problem comes when there is no segregation, everything is dumped together and into a dump yard, and then, there is burning, either purposeful burning or sometimes spontaneous combustion takes place. And this really releases a lot of gases, including some of the short-term pollutants that we talked about, like ozone and methane and nitrous and sulfur dioxides, very harmful for health, particularly for people who live in the vicinity of these dump sites. So cities in India have done it. Cities in other countries have done it. So I think we have enough examples in front of us to show us how, solid waste should be managed. Of course, India deal with a huge amount of solid waste. So it has to start with segregation, and then it has to, once you have the biodegradable waste that's been segregated, the glass and the plastic and so on, that goes off into a different route. And then you get your wet waste that can then now be really converted, into manure, into biochar, into gas, into many things, into biogas. It's when the plastic gets mixed with this and gets burnt that you get the really, really bad chemicals, heavy metals, as well as gases being produced. So I think, again, we do not often give enough importance and weightage to the fact that poor management of our dump sites and our solid waste is contributing so much to air pollution, creating so much of health impact. And I think, again, we need to empower our local bodies with the models that have already been shown to work. There's no need to reinvent the wheel here, so that they can implement solid waste management properly. So to me, this is, again, a very important but a neglected part of addressing our air pollution issues.
Okay, we know that health is severely impacted by air pollution, but how exactly does that happen? What does the latest data show?
Yes, so the status of global air quality report that just came out with data in 2023 basically shows that almost 8 million deaths annually globally are attributable to air pollution. In India, this figure is about 2.1 million. Many states have reported more than 100,000 deaths, 1 lakh deaths due to air pollution in 2023. It particularly affects young children. So children under 5 are very, very susceptible. And globally, 700,000 deaths in children under 5 are attributable to air pollution. Now, the key diseases that have been linked to air pollution are, of course, chronic obstructive pulmonary disease, but lung cancer. We've done so much to reduce tobacco use in the country, but now 1 in 3 lung cancer deaths are attributable to air pollution. 1 in 4 deaths due to heart disease are attributable to air pollution, and almost 1 in 5 diabetes-related deaths are attributable to air pollution. So its impact is through, worsening all these other diseases. And we know that in India, the burden of non-communicable diseases is growing. So both in terms of deaths, but also in terms of morbidity, that is chronic ill health, I think it's really having a disproportionate impact. And also there are estimates that in the national capital region of Delhi, that the air quality is reducing life expectancy by almost 8 to 10 years. So this is extremely serious.
So now taking a big picture look at the landscape of pollution control in India, the upside is that we've been in rooms where we've had that it's a bipartisan issue, and we've been in rooms where MPs from both the opposition and the government have spoken in one voice against air pollution and against other pollution, and seem to be eager to work together. This is, of course, apart from all the political bickering that one may come across in the headlines. But fundamentally, there is some kind of convergence there. On the other hand, there is a kind of a reputational risk, and we've seen a lot of eminent people speak about this, about how the image of India is taking a beating because of air pollution. It might be affecting tourism, it might be affecting investment. What is your suggestion for some kind of resolution, or how this can be fixed in a structural manner, in a sort of fundamental, deep structural manner?
Yes, I agree with you that air pollution, I think, is completely an apolitical issue, and as it should be, because I think that when it comes to our health, then all political parties should be and are equally invested in improving India's health. Now, the existing bodies that we have a National Clean Air Program. It's a non-statutory plan with no binding penalties. It's focused on 120 or so non-attainment cities. And we've seen that it's had limited success. Yes, there are some cities that have cleaned up their air as part of this, but we've not been able to meet the original targets.
Sorry, ma'am, if I may
and
interrupt.
Again, part of the issue, I think, is that a city doesn't.
Sorry, ma'am, if I may just interrupt to just define non-attainment for people who may not know that non-attainment means those cities who have not been able to achieve a certain target about improving their air quality.
Correct.
Please continue.
So the National Clean Air Program actually defined non-attainment cities as those that had not attained the air quality set by the national standards. And so the program is focused on these cities. It's a non-statutory and a non-binding program. Of course, there's a certain amount of funding that's been allocated. Again, it's been variably used from 6%, to 85% usage. The state pollution control boards are responsible actually for the implementation. They often lack autonomy and the enforcement mandate. And, the health metrics are actually missing in air quality planning. So I believe what we need to reimagine our, let's say, the National Clean Air Program and set up something like a National Clean Air Authority. I mean, the US did this. They brought in their, clean air law. And of course, they have the Environment Protection Agency as well. Environmental health today is becoming a real issue. There's air pollution, but there's also water pollution, and there are heavy metals and others where exposure is very harmful for human health. So one possibility could be to have an environmental health regulatory agency in India that is a science-based body which makes the policies, but which also has the powers of enforcement and has the legal authority to enforce the standards, whether it's on industry or on the pharmaceutical sector or municipal bodies and so on. And it's very important to involve the public and have a public-facing a body that is transparent with its data. In many cities today, actually, you do see billboards which give you the AQI measurements, in a real-time basis. I think that's excellent because it serves to both educate the public as well as inform them and create the demand, for cleaner air. So this kind of an authority, whether it's focused just on clean air, it could be a national clean air authority. We could launch something like a Swachh Hava or a Swachh Vayu program, just as like we had a very successful Swachh Bharat program that, created so much awareness about the importance of open defecation and its harmful impacts that today, we've seen a huge change in India as far as sanitation is concerned. Similarly, I think a holistic program on clean air with legally binding targets set, for both PM 2.5, but also for some of the other gases with sectoral budgets, maybe performance-linked grants to states and cities, a nationwide monitoring and data integrity system. Today, we have monitors mainly in the cities. In rural areas, we have very few air quality monitors. We need actually cross-ministerial authority as well as coordination, and this is why you need an apex body that would work across ministries and across states. We have to bring the health ministry in, so we need to link environmental indicators to health indicators. Immediately you start seeing the impact, on health, and that would give an added boost and encouragement to the program. Of course, you need an airshed-based approach, with, especially we talk about the Indo-Gangetic Plain. The airshed approach is very important, and it is a cross-border issue ultimately. So whether it is state boundaries or sometimes even national boundaries, the Indo-Gangetic Plain, you've got Nepal, you've got Bangladesh, and in fact, got Pakistan as well. And that whole belt gets impacted during the winter months. So having, being able to have these international targets and commitments is also very important. And of course, then you need to build in a crisis response. When there are acute smog episodes, then this authority must have powers to be able to implement those emergency measures. And then, as I said, public transparency, where you have open dashboards and citizen reporting portals where people can see, but also contribute to data. There are many NGOs and other civil society organizations which may be able to upload and contribute data to this portal. So that would really make it also people's movement, Jan Bhagidari, as we say. And I think we can really look at the impact of Swachh Bharat and how successful it was and say, can we now have a Swachh Vayu or a Swachh Hava program?
So this is actually quite fascinating to actually consider some kind of authority, some kind of regulatory body. Just to give us a sense, just to simplify it, because these are fairly complex matters, would it be similar to something like, they say, the RBI or the food regulator or the drugs controller?
Yes, you could look at it like that. You could look at it, say, for example, as we have the FSSAI, which regulates food, or the Central Drug Standards and Control Organization, the CDSCO, with the Drug Controller General of India, who has the authority and the mandate to inspect, to take action, to, he can put hold on any company that's manufacturing substandard drugs. They have to give a license, for every factory that wants to produce medicines and so on. So yes, so by law, they get the authority and they're mandated, and there's a governance structure and so on. So that's the kind of body actually that I believe we do need to address air pollution, but as I mentioned, also other environmental health threats that we have today.
So, just to understand this a bit further, there might be some who say that we already have the CPCP, which is sort of a regulatory body. It has a lot of responsibilities. The question is, of course, whether it's succeeded in those or succeeded in cleaning up India's air. We also have this new body called the CAQM, which is about 3-4 years old. If we have another regulatory body, pollution regulatory body, who would it supervise, one? And two, what is the kind of outcome that you would like it to have?
Right. So for this, we need to understand, as you mentioned, what do we have today on the ground and where do these need to be strengthened? So as far as the CAQM, the Commission on Air Quality Management, is concerned, I understand that it's limited to the National Capital Region. So it's very limited in its mandate. But yes, the Central Pollution Control Board and the State Pollution Control Boards are the ones which are now responsible, for taking action on air pollution. And what we've seen is that quite often they lack autonomy, they lack the enforcement muscle, and what they're able to do really is to impose fines on polluting, agencies or factories or whatever it is. But they have not had the impact. So when we look at the reasons, then I think you need, firstly, I believe that you need a science-based body. And this is why I mentioned the Environment Protection Agency as an organization, or in fact, even if you look at our drug controller or the food regulator, they do have scientists who understand the issues and who develop the policies and who keep on updating those policies, as things change, new technologies come. So you've got to also keep moving with the times very quickly. And for that, you need a strong scientific core. Then you need the implementing arm, which needs the mandate and the legal authority to go and enforce certain actions. And for this, they've got to be independent. They've got to have that authority. And the head of that agency is really got to be fairly senior, a person of high integrity, high technical qualifications, and the ability to actually take action. So you also, of course, need a budget which is commensurate with the scale of the problem. And so I think if you really look at the budgets which are allocated for the National Clean Air Program, they are insufficient. So the budget would need to be increased, and sector-wise, we have to make a calculation as to what is needed. For example, if a lot of retrofitting is going to be needed in our factories, then obviously that needs to be budgeted for. The private sector has to be brought on board as well. Obviously, they're a very important player here. And there could be many ways of doing this, through subsidies, through government schemes. Already the government is so focused on renewable energy, for example, and so many schemes have been created. Now, in the long run, that is going to help us as we move away from fossil fuel and move towards renewable energy. But we need to accelerate this process. So I believe that we need to, as far as air is concerned, set targets, ambitious targets. And we've got examples. We've seen China, reduce its PM 2.5 by 35-40% in 4 years. So it's not an impossible task. It's been done in the past. The European Union has, very strict air quality standards. They've done it. We've seen in London, the ultra low emission zones that the mayor introduced have had a huge impact. And in fact, he's had even more political support, though many people thought that he would lose political support because of some of the things he introduced. The mayor of Paris has done the same, increased cycling and walking lanes and improved public transport and reduced vehicles in the heart of the city. So many good examples from around the world, and within India, as I mentioned earlier, some cities have done a great job as well.
So one of the things that you mentioned was that health metrics are missing in air quality management, which is always a startling thing to hear. You also suggested a task force or a sort of a convergence of, the Environment Ministry, the Health Ministry, and a couple of other ministries, which seems to be an obvious commonsensical thing to do. You have worked closely with the government off and on. How feasible do you think this is?
I think it's very feasible. We've shown over and over again that when there is a clear need, a demand, and this results in political will and commitment, that India has been able to do things which were considered impossible. I think polio elimination is a good example. Everyone thought that India would be the laggard and that we would not be able to do it, but we did it. 2011, we declared ourselves to be polio free. By 2014, we were declared as a country that had eliminated it. COVID vaccination, no one thought that India would be able to vaccinate our entire adult population, but we did it. We've done the Swachh Bharat program. We are ahead of our targets as far as infrastructure on renewable energy is concerned. All of these have been driven, from the very top with a clear commitment, mandate, guidance. So everyone works together. It's almost like a mission mode where you have to accomplish something and everybody coordinates. So it is possible to do it in India. I think what we need now is to identify that air pollution is a major threat for us. It is a setback, not only for our health, but for our economy and, of course, our image as well. And therefore, if we address it on a mission mode, we also have all the components. We have all the data, the analytics. We know what is to be done. Of course, financing is going to be needed, and a mechanism is going to be needed, a clear, transparent mechanism, a governance. And again, as I said, this has to come from the highest level. But I believe that it's entirely doable. And in a matter of 4 to 5 years, we should be able to actually reduce our air pollution levels significantly if we do it.
I was just going to ask you if you could give some kind of time frame to that. 4 to 5 years is quite an ambitious thing. And just to put a few numbers on the threat that you were speaking about, in 2019, air pollution is estimated to have cost India $95 billion, which is equivalent to 3% of India's GDP. And it's probably a figure that's likely to increase. And as far as deaths are concerned, a new report has said there was something like 2 million deaths in 2023. That's well over 3 deaths a minute. And you had mentioned at the beginning how something like over 70 cities are in the annual ranking of the top 100 most polluted cities. So yes, there is a lot of upside to taking immediate action to this. To start wrapping up, I just wanted to touch on one other issue, and which is that we have a sufficient knowledge base. We have the required talent. I think the funds are also there. The government had recently said on how it's allocated and released something like 13,000 crores. But we don't see the pollution levels really changing that much despite a lot of focus on it. What do you think would be the steps to do? We've got the budget coming up in about 3-4 months now. What do you think would be the immediate steps that we can take towards reducing air pollution now?
So I think that, we have to take the next immediate step, I would say, would be a convening between the health, environment, and finance ministries at the center, but also consult, of course, the states. And there are many organizations which have worked on air pollution over the last many years. So in India, we have a tremendous amount of technical expertise, and all of these experts are willing to help and are very passionate and committed to working in this space. So we could do a convening right away. In fact, last year, the National Green Tribunal had organized a workshop on environment, and the top issue they picked was air pollution, and the others, were water and forests. So there were judges from the Supreme Court, High Courts, etc. All of them actually did express a lot of concern about the prevailing situation. So I think if we could come together, maybe have the legal experts as well over there as the technical experts to design this program, that the components of which, I described earlier, and a body that is empowered, accountable, and well-financed with clear targets. I think, that's the way to actually implement it. And we have other models in India that have been set up like that.
I see. Could you share a bit more about this NGT meeting that happened? What was the follow-up or any fallout of that?
So I think probably this meeting was to bring together a lot of people from, as I mentioned, the judiciary at different levels from the states and the center to discuss environment-related issues that are critical, that probably come up to the courts, quite often, once in a while. So there were members of the, green tribunals there, but there were also other people from the legal profession and judges. Many judges were there. In fact, Minister of Environment spoke. The Attorney General of India spoke. And while a lot of the progress that India has made on environmental aspects was highlighted, there was a unanimous agreement that poor air quality is a big issue for India that needs to be addressed. So I think we could bring on board the experience of the judiciary in having handled many such issues in the past, and frame this national program, as I like to call it, a Swachh Hawa or a Swachh Vayu program.
Thanks very much for that, ma'am. And just to wrap up, I think what you have given us is the contours of some kind of a plan to fix India's pollution crisis, perhaps a Swaminathan plan to fix India's pollution crisis. As we've underscored, it's politically bipartisan. We do have the funds. More funds can be raised. We have the talent. And I think the question is, do we have the will, the unity, and the coordination to pull this off, to fix India's air pollution crisis? Let me know your thoughts and feedback in the comments. And ma'am, thank you very much for making time for this conversation.
Okay, bye-bye.